Welcome to the tutorial, Updating Recommendations During the Patient Visit. Recommendations tracking allows the tracking of health maintenance recommendations across your patient panel and the printing of letters or sending of IQ Health notifications to patients with upcoming or overdue recommendations. This feature allows us to engage patients to actively participate in maintaining their health as well as improving patient care. Recommendations show the status of preventative care measures for a patient utilizing the standards defined by the United States Preventative Task Force. In this tutorial, you will learn how monitoring recommendations is vital to managing patient health, how to access recommendations on the patient's chart, how to identify if a recommendation is overdue, and how to manually satisfy a recommendation. In addition to assisting with managing patient care, managing recommendations assists with meeting a Stage 2 meaningful use measure. Core Measure 12. More than 10% of all unique patients who have had 2 or more office visits with the eligible provider within the 24 months prior to the beginning of the EHR reporting period were sent a reminder per patient preference when available. This means that we will use the data held on the recommendations tracking screen to send patient reminders for their preventative screenings such as mammograms, colonoscopy, and A1C. From the patient's chart, go to the Recommendations section. The Recommendations screen displays a listing of all pending and recently satisfied recommendations. During the patient visit, you will review the list of pending expectations with the patient and work to update or satisfy the items that are pending. Each recommendation has a set of satisfiers associated with it. Satisfiers include power forms and ad hoc forms, existing clinical results, events, or procedures, orders, specifically aspirin CVD, and manual satisfiers. Recommendations that are overdue will display with a dark red alarm clock, and the word overdue displays in bold. Some recommendations are automatically satisfied when you record past medical or procedure history or complete assigned tasks such as administering an immunization. Other recommendations can be satisfied by completing an associated ad hoc form. If a form can satisfy a recommendation, you will see the form name listed as an option on the recommendations screen. Clicking the form name will display the associated form for you to complete. Once the form is signed, you are returned to the recommendations screen and the item is marked as satisfied. During the patient intake, the patient may tell you that they had a test or procedure done at another location. That recommendation can be satisfied from the Recommendations screen as well by clicking the Done option. A Satisfy Reason page displays. Here you can indicate the reason you are marking the item as satisfied. Clicking the Reason drop-down displays a list of reasons, such as completed elsewhere. If applicable, you can also insert additional details pertaining to the event or click the OK button to close the window. When looking at the Recommendations screen, you may also notice the options for Postpone, Decline, and Cancel. These options should only be used by providers and will be covered in a separate tutorial, Managing Recommendations. If a recommendation is needed that is not listed, it can be manually added to a patient's chart. The steps for manually adding and managing a recommendation is covered in the tutorial, Adding Recommendations. This concludes the tutorial, Updating Recommendations During the Patient Visit. In this tutorial, you learned that displayed recommendations are based on the USPTF recommendations. We will use the details on the recommendations list to generate patient reminders for preventative services. How to identify if a recommendation is overdue, how to satisfy a recommendation through an ad hoc form, and how to manually satisfy a recommendation.